Hey, it's Adam Sewell, MD, and welcome back to the Medical Entrepreneur Channel, where we help doctors turn their expertise into thriving independent businesses. Today, we're going to talk about one of the hottest and most misunderstood opportunities in medicine right now. GLP-1 programs, you've probably seen the headlines. Semaglutide, Tirzepatide, massive weight loss results, celebrity endorsements, and a wave of new clinics popping up every month. But here's the problem. Most of them are doing it wrong. In this episode, I'll show you how to build a GLP-1 program that is safe, compliant, and profitable. You'll learn how to structure it, where doctors are getting in legal trouble, how to educate patients, and how to make it part of a larger metabolic optimization system that brings real results and recurring revenue. Let's get started. Section 1, Why GLP-1 Programs Are Exploding. The demand for GLP-1 medications has gone through the roof. In 2024, prescriptions for semaglutide increased by more than 500% compared to the previous year. Why? Because these drugs work. They mimic a natural hormone called glucagon-like peptide 1, which helps regulate blood sugar, slows gastric emptying, and reduces appetite. Patients can lose between 10 and 15% of their body weight within a few months, and for many, it's the first time they've seen real success after years of struggle. This has created an enormous opportunity for physicians, especially in cash pay settings, because patients are willing to invest in programs that combine medication with real medical oversight. Section 2, The Problem and the FDA Crackdown. Now let's talk about what's going wrong. The Food and Drug Administration has issued multiple warnings about the use of compounded or counterfeit GLP-1 drugs. They've seen unapproved versions of semaglutide that contain different chemical salts, mislabeled concentrations, and contamination issues. These are being sold through med spas, online websites, and even some compounding pharmacies that are not following proper sourcing rules. If you're running a medical practice, this is where you have to stay sharp. You can legally prescribe brand name products like Ozempic, Wegovy, or Mounjaro, and you can work with compounding pharmacies only if they are using active pharmaceutical ingredients sourced from FDA-registered suppliers, and only when an FDA-approved version is in shortage. As of now, the semaglutide shortage is resolved. That means most compounding use is not justified under federal law, so compliance is critical. The takeaway is simple. Do not cut corners with sourcing or advertising. It's not worth your license. Section 3, The Smart Way to Build a GLP-1 Program. Let's talk about how to do this right. A successful GLP-1 program is not just about writing prescriptions, it's about managing metabolism. Here's the structure I recommend. Step 1, Baseline Evaluation. Start with comprehensive labs, fasting insulin, hemoglobin A1C, lipid panel, thyroid panel, and liver function tests. This helps identify the patient's metabolic baseline. Step 2, Education and consent. Walk patients through the expected benefits, common side effects like nausea or constipation, and realistic timelines. Most weight loss occurs over 6 to 12 months. Step 3, Nutrition and lifestyle. If you don't add structured nutrition, resistance training, and gut health optimization, patients will lose muscle mass and regain weight later. Step 4, Ongoing monitoring. Follow up every 4 to 6 weeks to review labs, adjust dosage, and track progress. Offer a structured taper plan if the patient wants to discontinue safely. This is not just about prescriptions, it's a comprehensive medical program. Section 4, What to charge and how to structure it. Here's the part everyone wants to know. How do you price it? A typical cash-pay GLP-1 program includes initial consultation and baseline labs, ongoing medication management, nutritional support and accountability check-ins, messaging access for quick questions. Pricing model number 1, monthly subscription, charge between $300 and $600 per month, depending on whether the medication cost is bundled or separate. Pricing model number 2, program package. Create a 12-week or 24-week package with a fixed price, often between $1,500 and $3,000. You can also offer tiered options. For example, standard metabolic program for weight management and performance metabolic program for executives or athletes focusing on composition and longevity. Always make sure the medication price is transparent. Patients want clarity. Section 5, How to integrate into your existing practice. The easiest way to start is to integrate it into your current patient base. You can begin by identifying 3 groups. 1, patients who are already asking about weight loss. 2, patients with prediabetes, metabolic syndrome, or fatty liver. 3, patients who are already optimizing hormones and want better body composition. Offer these patients a structured consultation where you review their metabolic labs and explain whether a GLP-1 approach makes sense. Most of your first 20 patients will come from your own practice, not from ads. Once your workflow is proven, you can scale using telehealth visits and online follow-ups, as long as you follow state telemedicine rules. Section 6, patient retention and long-term value. Here's a key point. GLP-1 therapy should be a gateway, not a standalone service. If you stop at medication, you lose the long-term relationship. Instead, transition these patients into full metabolic optimization programs that include hormone balancing, peptide therapy, and lifestyle coaching. This approach increases patient retention and dramatically improves outcomes. For example, a patient who loses 20 pounds on Semaglutide can move into your ongoing Metabolic Mastery program. With a monthly retainer for continuous guidance and lab monitoring, that's where the recurring revenue comes from. Section 7. Avoid these common mistakes. Here are the 3 most common mistakes I see in GLP-1 programs. Mistake 1. Using the wrong source. If the pharmacy cannot provide a certificate of analysis for every batch, walk away. Mistake 2. Ignoring the lifestyle piece. If your program relies solely on the drug, your results will vanish when patients stop taking it. Mistake 3. Poor follow-up. Patients on GLP-1s can develop nutritional deficiencies, dehydration, and muscle loss if they are not monitored. Build protocols that include electrolyte support, protein intake tracking, and strength training recommendations. Section 8. Compliance Corner. You must have a proper medical evaluation and prescription relationship for each patient. Do not advertise GLP-1s as miracle weight loss shots. Do not sell or ship medications directly from your clinic unless your state allows in-office dispensing, and always document informed consent that includes off-label discussion if you're using a non-FDA approved indication. For telemedicine, check your state's prescribing rules. Some require an in-person visit before the first prescription. A compliant GLP-1 program is a safe and scalable one. Section 9. The math. Why this works financially. Let's look at the numbers. If you enroll just 50 patients paying $400 per month, that's $20,000 in recurring monthly revenue, or $240,000 per year. If you scale to 100 patients, you're near $500,000 in annual predictable income, without relying on insurance billing or pre-authorizations. Combine that with metabolic labs, peptide therapy, or hormone optimization, and your average patient value can easily exceed $1,000 per month. That's the difference between being busy and being profitable. Section 10, Closing and Next Steps. So here's your action plan. 1. Verify your pharmacy partner and only source from FDA-registered facilities. 2. Create a structured patient onboarding process with labs, consent, and follow-up. 3. Add nutrition and muscle-preserving strategies to every plan. 4. Price it clearly, package it professionally, and communicate results with confidence. If you'd like a free GLP-1 program starter checklist, including sample pricing models, consent templates, and compliant marketing language, download it using the link below. This is Adam Sewell, MD, and this is the Medical Entrepreneur Channel. If you're ready to grow your practice without insurance dependency, hit subscribe, and I'll see you in the next episode where we'll cover ketamine and esketamine programs, what a compliant model actually looks like.